दिवाळीची तयारी झाली का म्हणलं?
हो झाली सर, झाली. You can start, sir. You are ready.
करूया.
Yes.
बरेच राहिलेत अजून.
20 लोक आहेत वाटतं.
18, 19, 18 आहेत. असं करू, पहिले सुरू करतो मी. लास्ट याच्यावर काही प्रश्न असतील तर विचारत ते करूया आपण.
बरोबर. येस येस.
प्रार्थना सुरू करतो.
येस.
गुरुर्ब्रह्मा गुरुर्विष्णू गुरुर्देवो महेश्वरः गुरु साक्षात् परब्रह्म तस्मै श्री गुरुवे नमः. तस्मै श्री गुरुवे नमः. With due respect to Swami Kolananji, Dr. Naik, and all yoga students. Before starting the new topic, if anybody has got any question on the previous lecture, we can take, so that when little more people join, then we can start the topic. If anybody has got question, please ask.
So you can take Shilpaji's case. If Shilpa is ready there. Shilpa's case. Shilpaji, are you there?
Yes, sir.
Yes, तुम्ही आहेत ना? Discuss
Yes.
काय sir आहे.
Sir, मी व्हिडिओ पण ऑन केला.
Oh, it is not in the topic, but whatever. सांगा तुमचा ते issue सांगा कसा आहे. म्हणजे she's a very good yoga practitioner, practicing for so many years.
Okay.
Yeah, she's sharing her experience, like what it was with the doctors and her issues.
Sir,
हिंदी बोला, मराठी बोला, काही इंग्लिश पण चालेल.
अच्छा. डॉक्टर
बोला.
ऐकू येते माझा आवाज? ऑडिबल आहे?
Yes.
So I was in a starting stage of jaundice, and my jaundice was 2.47 when first it was diagnosed, and then it started rising also. I took a treatment from a BHMS doctor, and he had given me some saline, 2 salines in a day. And after that, I have just taken some Ayurvedic medicine for jaundice, and then it started rising, so it went to 25. After 25, I was admitted to hospital, and then I came to know in a CT scan and MRI that my gallbladder and my bile duct and my pancreas was completely affected and completely like gone out of order. So my bile duct was blocked. So I had endoscopy, first one, which he had put a stain of 7 mm. And then it got blocked. Again, he put the stain of 10 mm. This all was operated endoscopy at Kokilaben Hospital, Koperkerni. So again, he put the stain of 10 mm. But after a few days, again after 1 week, I got discharged from the hospital, and then I was just taking a treatment to the same doctor who was in Kokilaben. He was having a hospital at Kharghar, so I was taking the same treatment at Kharghar. So after that, as I was taking the treatment, he told to get admit to his hospital because I was having short breath, and due to that steroid and all, he cannot just give me and send me home. So I was again admitted to Kharghar hospital. So after that, again the bile duct got blocked, and then he had put 2 stain in my body again. One was at right, one was at left. So there are 2 stains in my body yet now. And next week I have been operating with removable of gallbladder, bile duct, and the pancreas head, the head of pancreas. And they are going to cut the long intestine and small intestine, and they are going to put a tube and attach to it. That's what he had explained for the operation. So he's a endosurgeon in Kokilabad.
Operation has been done or yet to be done?
No, next week, because there is some formalities pending.
So what is the diagnosis? It is pancreatitis with CBD stone, or what is it?
Not sir, not like that. There's only CBD structure.
Yes, stones in the CBD.
Yeah, CBD structure. Stricture.
Stricture.
Yeah.
That means that part has become narrow.
Yeah.
So that he will have to open it up and do anastomosis if possible. If not possible, then he might put it into the intestine.
And he has written this like malignant on brush pious pig. Benign on brush pious.
What is the biopsy report?
Biopsy report. It's no, once he had done, but it was benign something.
Okay, benign stricture. Then second time?
Second time it is not done. Now after operating, they will do it. After the operation, after the surgery, they will do it.
Okay.
It is Whipple procedure.
Whipple surgery.
Yeah, Whipple surgery. It's written on this paper. And so I have shown all my reports to Dr. Naik. I had visited him on Friday, and I've just shown him all the reports and all. So he told me, you can discuss with Dr. Pathak, and then everybody should know. And even I was wishing the same, but I could not open it after I had missed a lot of class. So I don't want to disturb the class. That's why I was not opening so many days. Yes.
Okay, you send me the reports on WhatsApp.
Yeah,
Biopsy
sure.
report, then sonography report,
Yes.
then stent report. Which
the doctor
stent
has given me, he is Dr. Prasad Pandey.
discharge card must be there, na?
Huh?
मागच्या स्टेंट टाकले ते डिस्चार्ज कार्ड असेल ना, त्याचा फोटो पाठवा मला.
हो चालेल डिस्चार्ज कार्ड.
आणि मग उद्या मग आपण पाहिजे तर डिस्कस करू त्याचं.
हा सर, उद्याचं माझं डाऊट आहे, कारण उद्या मी सिटी स्कॅनला जाणार आहे. सो आय डोंट नो व्हॉट टाइम इट विल बी.
सिटी स्कॅन झाल्यावर त्याचा रिपोर्ट येऊ द्या, मग त्याच्यानंतर मग
ते लोक डायरेक्ट डॉक्टरलाच देणार आहे, कारण मंडे मला ऍडमिट करणार आहेत कोकिलाबेन मध्ये, आणि ट्यूसडे आय विल बी ऑपरेटिंग. सो दॅट्स व्हॉट अप टू नाव देर इज दिस प्लॅन इज देअर. सो आय डोंट नो व्हॉट विल हॅपन. So I thought this is my last class.
Okay. Don't worry. If it is benign one, nothing will happen. That surgery will be smooth and without any problem. Don't worry about that. Now, what is the serum bilirubin now?
Now it is 3, sir.
3.
0.3 or 3?
3.
3.0 or 0.3?
3.0, sir.
Okay.
So they have told when it will come to 3 or 4, we will get operated. Okay. So up to now they had not operated because of my bilirubin was very high. When I spoke last to doctor, it was 8. So that was not a condition where they were ready for the surgery.
Anesthesia is a problem.
So now it has come to 3. So they told this is the right time to operate now.
Okay. You send this to me. And what time you are going for CT scan tomorrow?
Maybe, sir, morning or evening. I have to take the appointment.
You are not yet taken?
No. And after that, I have to meet doctors also.
No, but Sunday, is it working there?
Yeah. They are working, sir. Only Diwali holiday.
If you take a evening appointment, morning you can call me. at 10 o'clock, 11 o'clock, or 9:30 also.
Acha, I'll
You
call
send me the reports on WhatsApp
Yeah, I'll
today.
surely send you by tonight all the reports.
Yeah. And
Yeah.
if possible, we'll talk in the night only after lecture, after half an hour. Okay.
Okay, sir, no issues at all. Just I don't want to disturb the class, but doctor
So,
told me
okay.
to discuss
You send me the reports, and after lecture, after half an hour, we'll talk. Okay.
Okay, sir, no issues. No issues.
Okay. Okay. So we'll start today's topic. We have started cardiovascular system last week, and we have just covered hypertension, that is high blood pressure. Now, today we will be taking acute coronary disease or heart disease. Heart disease means any problem in the heart. It is heart disease. One of that is a acute coronary disease. Now, coronary disease is also called ischemic heart disease or ISD, or also it may be myocardial infarction, that is MI, and unstable angina. These are all for you. It is same, acute coronary disease. You don't have to go into detail, because you will get patient, somebody with the report that I have got ISD, I have got EMI, I have got unstable angina. So for you people, it is heart attack only. Now it is because of the less blood flowing through the coronary arteries, which are supplying blood to the heart. So that much, if you remember, that is sufficient for you. You need not go into the details of it. The ischemic heart disease. Ischemia means what? Anybody knows? Non-doctor. Ischemia means when the blood supply to any part is less. That is why that part, it cries a sort of cry of that particular part. That is a ischemia. So ischemic heart disease means when the coronary artery blood flow is less, so the muscles of the heart, they get less blood supply, and that is why I called it is ischemic heart disease. MI, myocardial infarction. Infarction means if any one particular part becomes dead because of the no blood supply, that is called infarction. And myocardial means muscles of the heart. So myocardial infarction, in short form, it is called MI. And third is the unstable angina. Unstable angina means patient gets little bit pain, severe pain, he rests, take deep breath, or take some medicine or take something, and he feels better. And absolutely normal, as if nothing has happened. Again, sometimes he gets same. So that is an unstable angina. Periodically, he may get pain whenever there is a less blood supply. Now, why there is less blood supply, that causes we'll see in the next few slides. But you just remember, ISD, MI, angina, for you people, it is one and the same, it is heart attack. Now, it occurs due to some kind of block in the coronary artery. As we have seen, the blood supply to the heart is by coronary arteries. The arteries which are supplying blood to the heart, they are called coronary artery. Now, if there is any block into the coronary artery, that means that particular part of the heart will get less blood supply. And if that part gets less blood supply, it will not work, and heart, as is, so many people are working, so they have got 14 days casual leave per year, 12 days half pay, 20 days full pay, something like that, isn't it? Is there any casual leave, half pay, full pay to the heart? Can you afford?
No.
Why? You are working in the office, you fight for that. No, we must get 14 CL, we must get 20 half pay, 20 full pay. Why can't heart also get some 10 CL? Can you grant 10 CL? 1 CL? Half day CL? No. 1 hour? अरे कहीं तो हाँ बोलो ना यार, बेचारा 24 डेज से हाफ 1 hour तक, half an hour तक आ गया. You cannot give him more than 3 minutes. more than 3 minutes, if his heart is not functioning or if a heart is not getting blood supply, the most of the heart part will die, and then it is called cardiac arrest and patient will die. So it is working 24/7, 24 hours by 7, by 60 by 60. So it hasn't got any rest. So the muscles of the heart, they should get continuous blood supply. The oxygenation should be up to the mark. Then only heart can work. Suppose you are taking rest, you are sleeping, you are running, walking, your legs are working more. You are playing something, your hands are working more. You are eating something, intestines are working more. But heart and lungs, they don't have any choice. 24 hours they are working. And that is why these two organs, they require 24 hours blood supply. And that too, full oxygenation. So SpO2 should be good. Then only they can function properly. Now, what are the causes of the heart attack disease? Mental stress. This is the most common. As in the previous lecture, sometime I discussed the lifestyle disorder, diabetes, blood pressure, heart attack. They don't have any organism causing the disease. As you know, malaria is caused by some organism. Cough and cold is caused by some virus. Typhoid is caused by some bacteria. But there is no virus or no bacteria which is causing heart disease. So the major toll is taken by the mental stress. More than 50% reason is the mental stress, tension. Nowadays, that's why it is said that 21st century is called century of tension. And tension is increasing like anything. And nowadays, I think last month or sometime you must have read in the paper also, lot of CEOs at the age of 35, 40, they have died because of heart attack. One or two famous Bollywood actors, they died at the age of 40 something because of heart attack. Recently, I think there was a news in the paper, some 18-year boy also died because of heart attack. So nowadays, everybody is having tension. And tension plays major role in all these diseases. So mental stress. Second is the atherosclerosis. Now, what is atherosclerosis? Any artery.
So the formation of cholesterol on the wall of arteries.
Atherosclerosis is, there are 3 layers on the blood vessel, artery. So inner layer, when blood flows through that, in cases of high cholesterol or triglycerides, these fat globules, they get attached to the inner wall of the artery, and there they form a plaque. So, and then there is a calcium deposition into that plaque, and that is why it is called atherosclerosis. So this is common when there is a high fatty diet is taken, there is no activity, sedentary life. Those people, they are having more chances of developing atherosclerosis. Cholesterol deposition, I just now said, the cholesterol globules in the blood, when the blood is flowing through that, they get adherent to the wall of the artery. And if one globule gets adherent to that, when the next globule comes into the flow, it gets stuck over there. So slowly they go on collecting over there and they form a clot over there or thrombus over there. And that is again dangerous because it will obstruct the lumen of the coronary artery and heart will get less blood supply. Then hypertension, that is high BP. We have seen last week that what happens in high blood pressure and what are the chances of getting heart attack. Then hereditary. This is a very good escapism for today's person, man, that if somebody gets heart attack and you ask, how come you got heart attack? What you will say? No, it is hereditary. My mother has got heart attack. My father also got heart attack. My grandfather also got heart attack. So you try to attribute it to the hereditary, but you don't try to attribute to a change of lifestyle. The new modern lifestyle, the changing in food habits, smoking, sedentary life, all these are causing it. But you don't blame them, you only blame your parents for that. Then obesity. Now, because of the modernization and because of the all the facilities available in the 21st century, the intake is not balanced with the output. The amount of physical exertion which was done in the past is not there. Just for example, I remember when I was in school, I used to walk at least 2 kilometers to go to the school. When I went to college, right up to medical college also, we used to walk at least for 2 kilometers to reach to the hospital, the medical college, when I was doing MBBS. So we didn't have any vehicle. So every day at least 4 or 5 kilometers we have to walk. And nowadays, even for half a kilometer also, there is a school bus or there is a parents, they take their kid into the car. And one day if the car is not there or gone for servicing, the child will say, no, we'll go by rickshaw. He will say, rickshaw, he will immediately shout. So this habit is changing lifestyle, causes less of the output, but intake remains same. On the contrary, it has increased. Are you doing any curtailing into the input? खाना खाने में कम करते हो क्या कि आजकल मैं काम नहीं करता हूँ ज्यादा तो खाना कम खाऊंगा नहीं because of the new chefs and they are giving different dishes our intake has increased. So if intake has increased, the energy which is generated or stored into the body, it is not spent because there is no activity, and that is why it gets converted into the fat. And these fats, they start causing problems. So obesity is another problem. Usually these people, they are likely to get heart attack in future. Then smoking and drinking habits. Smoking is very bad because it contains nearly 4,000 toxins. To name one, nicotine is one of the toxins which causes spasm of the artery. Have you understood what is spasm? थरथराट बोल सकते हैं ना, जो artery है suppose, so this wall keep on contracting, relaxing, contracting, relaxing. So what will happen? The blood flowing through that, because when it is contracting, the lumen is reducing in size. So blood supply to that particular organ is reduced. So smoking is 99% gives rise to heart attack. Now somebody might say, my so and so is smoking cigarette for last 40 years or 50 years. He didn't have any problem. He didn't have heart attack. He didn't have cancer also. So how can you say like that? So the reason is that when any patient is treated, we always take a history of the patient. What are his habits? What is past history and all that. So in that, when we have taken the history into consideration and the data analysis was done, in 1 lakh patients of heart attack, it was found that 80% patients were smoking, chain smoker were there. 80%, 90% of the patients of cancer, they were smokers. So we have said that smoking also can cause cancer. Now there are so many carcinogens which are there into that smoke. They cause alterations into the cell and abnormal cells are developing, and that is why patient gets cancer. Drinking habits, again, alcohol has got most important effect on liver. And if liver metabolism is damaged, liver is the storehouse. Whatever you are eating, whatever fat, carbohydrate and protein, they are assimilated into the intestine, and then they are stored into the liver, and then as per the need they are released. If liver is not functioning properly, then you will get problem. And alcohol has got effect, maximum effect on liver. So your all these dietary problems start when you are having the long history of drinking alcohol. Then sedentary job leading to lack of physical exercise. If you are not doing any exercise or any physical exertion, because just now I told you that in my school days or college days also we used to walk at least 3-4 kilometers for reaching the school. or college. Nowadays, everybody is using vehicle. You are going to your office, then again there you are using lift to go to the your floor, and then again you are sitting in AC for 8 hours without any movement, and then again you come back by the lift and come back, go home with the help of cab or bus or taxi or train. What is happening? The energy expenditure is not there. So lack of physical exercise, sedentary life causes again damage, and these people are more likely to develop heart attack. Then side effects of modern luxurious life. The 21st century is giving you all modern amenities. Now all these modern amenities, as they have got benefits, they also got disadvantages, and these disadvantages are few of these lifestyle disorders. And lastly, emotions. Emotions, they have got direct effect on brain center, and there is a sympathetic shift. Sympathetic activity increases. It is all mental stress only, because emotions, it may be good emotion, bad emotion, that will directly act on brain and you will have problems. So these are the few causes of heart attack. Now this is the heart. Then this is the coronary artery. It has got multiple branches. So heart has got, now suppose you take into consideration this part of the heart, the wall of this heart. Now this part is getting blood supply from this artery. It is getting blood supply from this artery. It is getting blood supply from this artery. Now suppose you take this part. This part is getting blood supply from this artery, from few branches from this artery. So each part of the heart is getting blood supply from multiple blood vessels. Why multiple blood vessels? Suppose one gets blocked, another will try to supply the blood. But when there is a major block, suppose it gets blocked over here, this part will get less blood supply, and then patient gets heart attack. So nature has already provided multiple channels, multiple collaterals, so that heart will get proper blood supply. But in spite of this, suppose something goes wrong, and if blood supply goes down, then the problem starts. Now this is the inner picture of the heart. This is the superior vena cava, this is the inferior vena cava, and this is the right atrium. The impure blood from all over body above the heart level comes through this superior vena cava into the right atrium. Then this is the inferior vena cava. The blood from all over part below the heart level comes through this to the right atrium. Now when this right atrium is full of impure blood, then this wall opens and it goes into the right ventricle. When right ventricle contracts, this blood flows through this pulmonary artery to the both sides of the lung. It gets purified over there, and after that, oxygenated blood comes through these two pulmonary veins to the left atrium. From left atrium, it comes into the left ventricle when this mitral wall opens, and then this blood, when heart left ventricle contracts through this aorta, it is going to the all over body. Now, heart gets blood supply. See, these are the walls. This was a diagrammatic picture, and this is a real picture. Here you see the walls. They have got these are the tentacles, chordae tendineae. These keep the walls in a good condition, and whenever this blood has to go over there, this wall will open here. When this blood has to go to this side, this wall will close and this wall will open. Then only blood can go this way. If this wall doesn't get closed, what will happen? When this will contract, half of the blood will go to right atrium, half of the blood will go to this vessel. So these walls, they should be perfectly working. Now, what is the frequency of these walls working? Heart is working 24/7. In 1 minute, how many times heart is contracting?
72.
Yes?
72 times.
72 times. So in 1 minute, this wall is opening and closing for how many times? Anybody?
72 times.
Yes, correct. So in 1 minute, this is opening and closing for 72 times. So 72 times multiplied by 60, it will become 1 hour. Then multiply by 24, it will become 1 day. Multiply by 365, it will become 1 year. And then multiply by your lifespan. So that many number of times this valve is opening and closing. हम लोग आधा घंटा काम करते एक ही चीज बार बार करते तो थक जाते हैं. Don't you think that these valves also might get tired if they are doing so much work? You cannot, if you try to calculate it, it will be very difficult for you to calculate. In a span of 50 years, how many times this valve is opening and closing? Very difficult. And suppose you calculate it also, that number will be very huge. So this work is done by this valve. So the health of this valve is also very important. Now this heart, this pump, is when it's contracting, the blood is flowing through this to the brain, through this to the hand, then through this, then it comes through this to the leg. So these parts, they are far away from the heart. Now lungs are very close to the heart. Brain is quite close to the heart, but the fingers, toes, they are very away from the heart. So if all these parts, they should get proper blood supply, then this pump should be working properly. If the pump is not functioning properly, what will happen? These parts will not get proper blood supply. Now for proper functioning of this heart, these are the coronary arteries which are supplying blood. If these coronary arteries, if they can supply proper blood to the heart, then it will function properly and you will not have any problem. But if there is any block like this, suppose this artery gets blocked, what has happened? This part has become totally dead. So it is called heart attack or myocardial infarction. Now this patient is admitted in the hospital. There what we do? We try to, suppose it has been blocked by some clot, then we try to give some injection which will dissolve that clot. So when patient is admitted immediately to the hospital, first thing is done that they give the injection which will help to dissolve this clot. Then what we do? First we do ECG, electrocardiogram. Then we do angiography. Then we do, first we do stress test and then do angiography. How angiography is done? See, this is the aorta. Now the blood vessels into the heart, we have to picturize this vessel to see whether there is any block or not. So how we can do that? So what we do? Angiography. Here in the groin, we put a small catheter through this femoral vein, or we can use radial artery, the wrist here, and this catheter is slowly pushed up, pushed up, pushed up, pushed up, pushed up. Then it will come. We have pushed it up, pushed it up, pushed it up. Then it will come over here. When it reaches over here, then we inject the dye, because these coronary arteries, they are arising from the aorta just immediately after the aorta comes out of the heart. So when we put the catheter, this catheter is pushed like this from here in the groin or from the wrist. It is pushed like this slowly. It is under the X-ray machine guidance. And once it reaches over here, it will come over here, it will come over here, it will come over here. And here what we do? When it reaches over there, we inject a radio-opaque dye. What do you mean by radio-opaque? Anybody? Yes?
The dye which is through which the radiogram, I mean, X-rays can't pass. Radio.
Yes,
means
correct, correct. Yeah. Now, suppose we take a chest X-ray. We have seen X-rays yesterday, last week. So, do you see, you see the bones? Why? Because through bone, X-rays cannot pass. But they can pass through tissue and blood vessels. So, you don't see the blood. You don't see the muscles. But if you inject a dye, that is a radio opaque dye, that dye, as he said, that through that the X-rays will not pass. And what will happen? It will delineate. It will show the coronary arteries over here. And when these coronary arteries are seen, then in that we see if there is any block. And then if there is a block over here, this part will be totally dead and this block will be seen over here. In the last lecture, I have shown you the angiographic picture and radiographic picture. So there the block is seen. And then if that block is yeah. See, now here you see the dye is going through this artery, and that is why this you can see this is a normal diameter, but here it has narrowed. So here you can say there is a block. Now depending upon the block, now suppose the block is over here, then what will happen? Most of the 50% of the heart will not get blood supply. So such patient will require immediate either dissolving the clot or angioplasty so that this clot will be dissolved, or stent is put so the passage of the blood is rearranged and patient will be surviving. Suppose now how the angiographic pictures are read. See, this is one coronary artery, this is left coronary artery, this is right coronary artery, and then these are the branches of it. As I told you, heart has got blood supply from multiple places. So suppose block is over here, you need not worry much because this part will get blood supply from here or blood supply from here. But if the block is over here, then what will happen? Whole of this part will not get blood supply because all other branches are also emerging from here. So the block, if it is here, this patient is a serious condition. So here he requires immediate surgery. Now, if it is only single block, if there is only one block seen, then it is okay to do. Now, suppose now this is a single block. So just one stent will be sufficient. But if patient has got multiple blocks, means one block is here, one block is here, one block is here, one block is here, then one more block is here. So what will happen? You cannot put so many stents. So in those cases, patient is advised to undergo bypass surgery. So what is the difference between stent and bypass that we have seen? So here you can see this is the coronary artery and this is the atherosclerosis. That cholesterol has got deposited over here into the inner wall of the artery and it has swollen up. And that is why what has happened? The lumen of the artery has become narrow. So suppose in 1 minute, 20 cc blood is flowing through this artery. Because of this block, only 10 cc will flow. And if the 10 cc blood flows, if less blood supply is there to the heart than the required one, that part will die. And that is why the myocardial infarction or heart attack is there. Because the blood supply to the heart muscle should be adequate or optimum. Moment it goes down below 30-40%, patient develops